Hey guys, it's me, Dr. Samina Rahman, Gyno Girl. I wanted to get back into the swing of things here with YouTube. I did a video on the genitourinary syndrome and menopause before, but I have a little different perspective that I wanted to share with you today on vaginal estrogen. So let's get at it. Okay, hi guys, I'm Dr. Samina Rahman, Gyno Girl. I'm sorry I've been a little bit out of it lately because I'm in the sandwich generation. I help take care of my parents and my in-laws. I have kids, I have a practice, and life gets kind of busy. But I'm really here dedicated to educating vagina owners around the world to keep themselves sexually healthy, good vaginal, vulvar, clitoral health, the whole thing. Today what I want to discuss hits home personally, and so I wanted to just bring this out into the open. Lately, I've had a family member in the hospital, an intensive care unit. She happens to be postmenopausal, had been doing really well overall when it came to her genitourinary health. But guess what? Caretaker missed getting her 1 dose of estring, which is her vaginal estrogen supplementation that we've been using for the genitourinary syndrome and menopause. Now remember, I did a video on it and we talked about how estrogen is so important for your vulvar, vaginal, clitoral health, but also your bladder. That's why it's a genitourinary syndrome and menopause, because as the estrogen levels decline, the pH of the vagina changes, the bladder is lined with estrogen receptors, the trigone and everything like that. So we know that with the decline of estrogen, we have changes in the bladder, the cells change, the turnover of the cells change, the ability for bacteria to get into the bladder is much worse in postmenopause as estrogen levels decline. The same is true for painful sex when it comes to postmenopause and lack of estrogen, as well as vaginal discomfort, vulvar issues, wanted orgasms, libido, all that stuff. And that's all related to the decline in estrogen and testosterone that we experience perimenopause and postmenopause. So the little tidbit I wanted to share with you, because I did a video about the different types of vaginal estrogen supplementation for the genitourinary syndrome and menopause. But guess what? It turns out that estrogen, when done topically, which is very safe, systemic absorption is minimal. When given estrogen topically, and I'm talking about specifically vaginal estrase cream, DHEA derivative of Intrarosa, E-string, the estrogen-based vaginal ring, Imvexi, the estrogen tablets or suppositories that you put in, Uvifem. I'm talking about a large number of available options for women experiencing menopause, postmenopause, perimenopause. And as a general rule, I try to encourage any of my 45-year-old patients or older who are in that perimenopausal state or maybe premature menopause, whatever, we have a discussion about use of vaginal estrogen as well as systemic estrogen in some cases. That's a different story. The point of this whole story is that the family member that I had ended up in the ICU, the intensive care unit, after having a urinary tract infection. So in the elderly, and I'm talking 70s, early 80s, something like that. In the elderly, when you get a bad UTI, especially if you have any level of dementia, your mental status changes. You might become somnolent, sleepy, that kind of stuff. The worst case scenario is when the bacterial infection goes from your urine into your bloodstream and you become septic. And then we call that urosepsis. And guess what? She missed her estrogen ring that she was taking every 3 months. The caretakers were providing her. She missed it. In that 3-month period of time, she developed a very significant resistant to multiple antibiotics. And she developed urosepsis. She ended up in the ICU, kidney failure. The next step, could have been demise. And so, we're grateful that we were able to get her the care she needed. But my general point is the estrogen in the vagina could have very well prevented this urinary tract infection, which has then led to urosepsis, intensive care admissions, as well as kidney failure that develops secondary to all of this. So take-home message is vaginal estrogen can be life-saving for women, bladder owners, vagina owners, vulva owners, everyone that is going through this phase. It is inevitable. If you have ovaries, you will at some point, and you live long enough, you will at some point go through menopause, perimenopause, postmenopause, the whole thing. And so as these levels decline, we know what happens to our vagina and we know what happens to our bladder. And there are things that we can do. And one of the easiest things you can do is vaginal estrogen supplementation. This could have prevented a ICU admission. This could have prevented the stress around possible declining conditions. So my message to you is, if you have a loved one that you know is in perimenopause, postmenopause, and it's not even having to do with sexual function, which we know it improves. It's not even having to do with general irritation and discomfort. But using these vaginal suppositories, so if you're using the cream, the pill, it's every day for 2 weeks, then twice a week until the end. If it's the intrarosa, the DHEA derivative, you can use it every night. If it's the estrogen ring, the E string, it's every 3 months, which is easy for patients who are elderly and not able to continue to change and use estrogen every night. But I would like to just remind everyone that this is a simple thing that we can offer our loved ones who happen to be going through this as a prevention, because this could have seriously prevented the things we went through when it came to the urinary tract infection that led to urosepsis, that led to her kidney failure, that led to ICU admission for 2 weeks. My loved one is still in the hospital, so this is obviously, very fresh in my mind, and that's my take-home message today. Please, if you know someone, if they don't have the right provider, look up the North American Menopause Society. There is a list of providers that are trained in menopause treatment, including myself. I'm a certified menopause doctor through the North American Menopause Society, and that is how you can find the appropriate person to help you. Sorry about the dog. All right, you guys take care, and there's more to come.